Nowadays, lots of people complain about premature graying of hair and hair loss seen in their children, school going children and college going children. So, why is this happening? So, first of all, there can be genetic factor in it. If the parents have their hair graying at an early age, then children will also have. Most common factor which is seen in all these patients is their diet. Due to dietary deficiency of vitamin B12 or vitamin D, iron, folic acid, there is hair loss as well as premature graying of hair. So when such patient come to us, these children, we advise them, we give them supplements for 4 to 5 months, but at the same time we give them dietary advice, so that when the level, suppose iron is low, hemoglobin is less, then once the hemoglobin is normal, 14 to 15 milligram, then after that maintenance they can keep, and they by diet only, they will not require supplements after that. So what are the foods which are rich in these vitamins and iron? We know that spinach, fenugreek, dates, peanuts, jaggery. So all these they contain, and along with that nuts, they contain lots of iron and folic acid. Also similarly, green leafy vegetables, all kinds of pulses, lentils, beans. So these children, they should eat lots of pulses, dal rice and chickpeas, chole, and all the masoor, urad dal, like that. And similarly, vitamin D sources, it is sunlight, so they should be allowed to play in sunlight daily 1 hour. They should do exercise or running, cycling, or any other game which they want to do. Similarly, vitamin D sources are fish, eggs, as well as mushroom. Now comes most important vitamin, B12 vitamin, and this vitamin is seen mostly in non-veg, that is eggs, fish, meat. And those who are pure vegetarian, generally it is seen that they have deficiency of vitamin B12, and then they are advised to have intramuscular injections of vitamin B12. And what we advise is daily these children should get 1 glass of milk and 1 banana and 1 egg. If they are adolescent, they can have 2 eggs, including egg yolk, so that they get all this vitamin B12, iron, folic acid, as well as vitamin D in sufficient amount to avoid this premature graying of hair. Once the hair which is gray, that will not become black, it will grow, and once it is fallen, then afterwards the new hair which will be coming from the hair follicle, that will become black if all this deficiency is replenished. Similarly, sometimes hair loss can be due to some diseases, like patchy hair loss is due to alopecia areata, that is autoimmune disease. Sometimes it can be due to infection, like tinea means fungal infection over the scalp. In that case, there are scales, as well as there is itching over the scalp, and there is the bald patch. So treatment of that condition, after treating that condition, there will be again hair growth over that area. Sometimes hair loss in patchy hair loss is seen in alopecia areata, and in vitiligo, in some diseases like vitiligo as well as alopecia areata, these are autoimmune diseases, there can be graying of hair earlier. So all these conditions, along with some hormonal diseases like thyroid disorders, this can lead to hair loss as well as premature graying of hair. So we can do blood test, we can find out, we give dietary advice, which is the most important, because in generation previous to this, there were no junk food or eating outside restaurants, ordering food online, like this culture was not earlier there. So at that time premature graying was not seen that much. Nowadays stress has also increased, use of mobile, laptop, this has also increased, which increases their screen time, and the food which we are getting due to pollution, due to chemicals, due to insecticide spray. Already it has less nutritive value, and there arises the need for supplements, as well as more and more we should try to give them dietary habits that is rich in all the fresh fruits, vegetables, whole grains, cereals, pulses, all kinds of sprouts, fish, eggs, milk and dahi, curd. So this will prevent further complications like diabetes at the age of 25, or hypertension at the age of 25. We are hearing more often nowadays. So basic is change the lifestyle, change their eating habits from early childhood only.